Thank you. It's a pleasure to be here. And I really want to say thank you also to Marilyn Williams and the Eastern Shore Lyme Disease Association. They put an incredible amount of work and effort into getting all of us here. And the discussion that we're having today is super, super important. And I'm really excited that you guys are all here hearing about this as well. As we all know, Lyme is extremely controversial. There's a lot of societal forces at work. However, it's also a very exciting time in Lyme. I feel like we're kind of reaching this tipping point where they're starting to see some movement, policy work, patient education. So the fact that you guys are here is really, really wonderful. Thank you. So I want to provide, today I hope to provide an overview of the importance of gut health in tick-borne disease patients. We know that tick-borne pathogens directly affect the gut. We also know that the antibiotics that we use can cause major gut dysbiosis, alterations of the gut immune system. There's a big role for leaky gut, gut inflammation, and it's how it plays into systemic illnesses. We'll talk about food allergies, food sensitivities, as well as other intestinal parasites, bacteria, etc., that can be harmful to the gut. And I really, really believe that addressing gut imbalance is critical for the ways it can help to decrease inflammation, to modulate the immune system, decreasing both local as well as systemic symptoms, potentially decrease the side effects of antibiotics, hopefully shorten tick-borne disease protocols. And in my opinion, if we pay careful attention to the gut, we can restore health faster, more completely, and help to maintain remission in patients once we're able to get them off of treatment. So what we're going to learn today, we're going to talk about some functional medicine concepts, this idea of the 4R protocol for diagnosing and treating gut imbalances. We're going to move into a discussion on a variety of different diets. We'll talk about gluten-free, we'll talk about the anti-inflammatory diet, we'll talk about GAPS diet, which stands for gut and psychology syndrome. We'll talk about Paleo Diet, which is a lot of information out there in the media these days, as well as body ecology, anti-candida diet. And time allowing, we'll touch on some supplements that can be helpful for gut healing. So in a nutshell, we're going to talk about how to avoid total bowel destruction in tick-borne diseases. So Hippocrates really knew this way back in the day. He said that all diseases begin in the gut. And in my work and in medicine, I think that the gut is really the center of the universe when it comes to health. And we know that tick-borne infections can directly harm the gut from top to bottom. The gut-associated lymphoid tissue represents 50 to 70% of all the lymph tissue in the body, and probably at least 70% of the total body immune system is located in the GI tract. Tick-borne infections can cause inflammation, increased intestinal permeability, which is also commonly called leaky gut. They can cause malabsorption, pain, reflux. Bartonella has been a known cause of what we call H. pylori negative gastritis. And really this is, I think, very similar. It's a vasculopathy of many different sites of the GI tract, which is very similar to what we see in the stria on the skin exam. There's also a large amount of neurological involvement of these infections in the gut. This has been called Bell's palsy of the gut. Also, mycoplasma has been isolated in gut biopsy samples of tick-borne disease patients, can cause damage via upregulation of cytokines, inflammation, etc. So the work of Martin Fried has been really important in this field. He's a gastroenterologist in New Jersey, and he's shown on colon biopsy spirochetes in those samples. And he published this paper in 1996 in the Journal of Spirochetal and Tick-borne Diseases. He looked at 10 kids ages 8 to 19 with Lyme disease. With biopsy-proven inflammation in the stomach, duodenum, colon, gastritis, duodenitis, gastric ulcer, colitis, Crohn's-like histopathology. And he showed that in 5 out of 10 of those kids, they had spirochetes resembling Borrelia in their GI tract. So one important point about this is that we know Dr. Burrascano touched on it, that it can be hard to find Borrelia in the blood, either from an antibody point of view, from a PCR point of view. we're hopeful that there might be some movement with the culture test. But Borrelia frequently can be located in tissue samples. So if you ever have a patient who goes, for whatever reason, they're getting a colonoscopy, they're doing an EGD, they have to biopsy a lymph node or skin, et cetera, send that sample, write an order, get the pathologist or the ordering doctor to send a sample for a PCR for Borrelia, and you'll be surprised. Sometimes you'll find it. And that can be very, very helpful for the diagnosis if you're not able to find it in other compartments. So this is a nice article by Virginia Scher called Bell's Palsy of the Gut and Other GI Manifestations of Lyme and Associated Diseases. And this is a nice overlay of the idea, again, of that Bell's palsy or neurological paralysis that can happen with the face, can also happen in the GI tract. And she showed that Borrelia and tick-borne infections can cause gastrointestinal tract abnormalities anywhere along the entire length of the GI tract, from the taste buds to the muscular strength of the tongue, gag reflex, ability to swallow, gastroparesis, alterations in peristalsis, all the way to total arrest of peristalsis, ileus, pseudo-obstruction, dysbiosis, we'll talk a lot about that, anorexia, nausea, vomiting, abdominal pain. Dr. Horowitz touched a lot on the possibility of hepatitis, hepatomegaly, splenomegaly, also co-infections, as he talked about here, very important. Multiple factors are involved here. There's neuropathic sequelae affecting the vagus nerve, affecting the local nerves, as well as local and systemic inflammation. And what I hope to show you is that we then stack on top of this the growing body of evidence that our modern diet greatly contributes to inflammation. It's a really nice article, July 2013, in Microbes and Infection, called The Role of Diet in Triggering Human Inflammatory Diseases in the Modern Age. And they show that the Western diet has a really strong impact on our gut microbiota, our second genome, really, contributing to states of immune imbalance, heightened inflammatory states, etc. So we see here, that in the presence of a high-fat, high-carb diet in a genetically susceptible host, that you have direct effects that cause systemic inflammation. And the pathways through which is mediated is through the microbiome, through the balance of the good and the bad bacteria in our guts, okay? So, we see with these inflammatory changes, lowering of the beneficial commensal organisms, an increase of these sort of bad players, what we would call pathobionts. We see invasion of the lamina propria, increased intestinal barrier disruption, and increased inflammation. So furthermore, we see that there are clear links between gut inflammation and systemic illness. For example, this 2010 article on gut inflammation in chronic fatigue syndrome, it was shown that in chronic fatigue patients, they have altered intestinal microbiota, they have increased intestinal permeability, mucus barrier dysfunction, bacterial translocation like we saw, and altered mucosal immune system with loss of tolerance to gut pathogens. And this idea of loss of tolerance to our own bacteria that exist in our gut is super, super critical. Very important concept. This is a nice study, 2010. Scully et al. Showed that in IBS patients with extraintestinal symptoms, these patients have higher levels of inflammatory markers. So IBS alone, you do see elevated IL-6, IL-8, increased inflammation. However, in patients with extraintestinal manifestations, you see even more inflammation. For example, fibromyalgia, chronic fatigue. You see that IL-6 high, you see the IL-8 high, but now you also see IL-1 beta, TNF alpha. So leaky gut or intestinal permeability is really a central player here. And the research now shows that these tight junctions in the gut are dynamic structures, okay? They can be opened, they can be disrupted, they can also be healed. Some of the things that cause them to open or become disrupted include inflammation, infections, foods, allergies, sensitivities, stress, toxins, antibiotics, candida, pathogenic fungi, etc. All these are very important players. So the work of Alessio Fasano has been really critical in this field, and he's helped to identify some key tight junction proteins, including zonulin here and occludin here. And it's disruption of these tight junctions in the intestine that allows macromolecules to access our bloodstream. And again, this has been linked to multiple different systemic illnesses. So in the healthy small intestine, you have intact villi, intact tight junctions, and the body gets to decide who comes in and who stays out, okay? However, in a disrupted state, you have small food particles that are undigested, you have pathogenic bacteria, fungi, et cetera, that leak in, and they create this cascade of inflammation here. And the body loses selectivity. It loses the ability to decide, okay? So again, Alessio Fasano has been very active in this area. This 2012 article connects leaky gut or gut permeability to a variety of different autoimmune illnesses. He showed increased incidence of celiac disease, type 1 diabetes, asthma, multiple sclerosis, inflammatory bowel disease, ankylosing spondylitis. Very interesting also, this idea that blood-brain barrier permeability is connected to increased gut permeability, okay? So when you have gut inflammation or you have high levels of systemic inflammation, the cytokines that are produced circulate throughout the whole body and can serve to open up the blood-brain barrier. That's been very definitively shown. There's some great work out of Columbia. Maddie Hornig is a really impressive researcher in this area as well. So in the case of celiac disease, when we're exposed to gluten, this little fragment here, in patients who are HLA DQ2 or DQ8, so they're genetically susceptible, you get release of zonulin. And zonulin, again, serves to bind to this receptor and open up those tight junctions. And what we then get is this huge inflammatory cascade, like we saw. Antibodies are produced against gluten. But then the second step that occurs is that antibodies are also produced against tissue transglutaminase, which is an enzyme that normally resides inside of our own cells, but it's released with the cellular damage. So this is an autoimmune phenomenon. This is a nice article in the pediatric literature in 2005 showing that microbes, toxins, proteins, food-derived exorphins, when there's in the presence of leaky gut, come across and trigger, again, a whole variety of different systemic illnesses. And the idea of these autoimmune type illnesses, we don't really understand autoimmunity very well in Western medicine. We have pretty crude tools to try to control it and treat it, basically trying to turn off the inflammation or suppress the immune system. But the thing that we do know really, really well is that if you have one autoimmune condition, your chances of getting a second one or a third one or more is much, much higher. So the goal really is then to heal the gut, to decrease inflammation, both from a local level as well as a systemic level. How many of you have heard of the 4R program or protocol? Great, so a few of us, great. So if you haven't heard about this, I really, really recommend go home, look it up, read about it. It's very simple and offers a really, really important template for dealing with gut imbalances. And there's basically 4 basic concepts. Remove the bad guys, okay? Triggers, allergens, antigens, pathogens, parasites. Replace what might be missing, digestive enzymes, stomach acid, etc. Re-inoculate, give back the beneficial bacteria that we want to be there. Give both probiotics, which are those bacteria, but also prebiotics, which is food for those bacteria so they can better colonize and grow. This can be supplement form. This should also, I think, be food-based, fermented foods, etc. Our ancestors and indigenous cultures had it right. And then also repair. Once you've done these first steps, go back in and use some gut mucosal integrity nutrients and try to help heal that. So the first element of remove that I want to talk about are food allergies and food sensitivities. So we'll talk a little bit about how to diagnose those and treat those. So there's various elements to this. In our Western medical model, food allergy is thought to simply be IgE antibodies, and that's pretty much the only thing that counts if you go to the allergist. IgG testing and looking for food antibodies is also really helpful. It is a little bit controversial. When you see a test like this, where there's a bunch of different foods that are lighting up, this is an IgG test. You see a bunch of different foods lighting up. It's not clear if each and every one of those foods are causing symptoms for the patient, okay? This could be just a proxy marker for leaky gut, for intestinal permeability, so that whatever the patient is eating frequently, they start making antibodies to. But this is an immune response, and in clinical practice, I can say that it has been very, very helpful, and frequently eliminating, particularly the higher reactive foods, the 2-star, 3-star foods, and maybe putting them into a rotation diet where you rotate the other foods so they're not seeing it more frequently than once every 4 days. That can really help to dampen down the immune system. And this can also be sort of a template or a beginning for helping the patient do an elimination and reintroduction type diet. This is a nice panel that's available. This is a gluten cross-reactive food panel. So this is either foods that our body might think looks like gluten. Incidentally, coffee can cross-react with gluten for a lot of people. So if you are celiac or gluten-free but still drinking coffee, there's about a 10% chance that your body might think that still looks like gluten and be reacting to it. And then this also is a panel which includes a bunch of foods which we tend to eat a lot of if we're doing a gluten-free diet. So also very helpful. Elimination diet. So again, the testing, as I mentioned, the IgG testing can be imperfect, as are many tests. So the elimination diet is really kind of the gold standard. And basically, this is where you strip everything out, you put the patient on a very, very simple diet, and then after a period of time, reintroduce foods one at a time while they're doing careful tracking, journaling, tracking symptoms, if they're seeing if there's any reaction. And if there's a reaction, that food's out. If there's clearly no reaction, that food's probably fine. And if there's somewhere in the middle, I ask people to try it again. Get rid of that food, bring it back in later and see what happens. You should know about this. I'd like to include this up here because the School of Medicine in Wisconsin, the University of Wisconsin, has a really, really nice complementary and alternative medicine program as well as a fellowship. They have a bunch of really good handouts on their website. So for patient education, as well as for your own practice, these are really, really helpful. So let's look at a case. This is a 12-year-old boy. We're going to talk about the importance of eliminating dietary triggers. 12-year-old boy came in to see me fall of 2001 with sudden onset of acute panic attacks. It was preceded by a flu-like episode, and then he got a flu shot while he was still recovering, which I think did further trigger his immune system. He began having obsessive, perseverative thoughts, hearing voices, visions of bad things happening. My first visit with him was about half me trying to gather information and half me trying to reassure him, because there's constant questions. I feel like I've been bitten by something. My teeth are sharper than they were before. I'm having thoughts of me biting necks like a vampire. Am I okay? Am I okay? Am I going to get better? What's wrong with me? All these questions. Before he saw me, he had been admitted to a psych hospital. They had started him on Prozac, clonazepam, Seroquel. I saw him and I was concerned about the possibility of an infectious trigger. I diagnosed him with PTAND, pediatric infection-triggered autoimmune neuropsychiatric disorder. And right away I started him on some Augmentin and sent off a bunch of testing. Testing came back, did show some exposure to Borrelia. It wasn't a slam dunk. There was some indeterminate antibodies. There were some positives on less specific bands. The Augmentin, when I saw him back, the Augmentin had helped. I added azithromycin. We subsequently did an IVIG treatment. At this point, he was probably about 60% better. I was able to stop all the psych meds, and he was stable. Additional testing came back. WA1 babesia was slightly elevated at 1 to 256, and he was also complaining of shortness of breath. So we started Mepron, treated him with this for 4 months. at which point he was about 75% improved. Did some food testing, showed a bunch of different antibodies to gluten. We eliminated gluten from his diet, and he had a marked clinical improvement. He's probably about 95% better now. Great, we're feeling good, right? This is a result of his gluten testing. All these markers up here. There's a line on this panel right about here where everything above this is different fragments of the gluten molecule, and everything below are autoimmune markers. And this panel, this company, Cyrex Labs, they now have a number of other tissue transglutaminase isoforms that they show on their testing, which is really helpful. Treated him with Mepron, stopped the Mepron. They rechecked the WA1, had gone down to normal. However, he stopped the Mepron and started having increased symptoms, more questions, more nightmares. I gave him some herbs which are specific for Babesia, and he flared. He had a provocation type reaction, which in my mind is a Herx. Rechecked the WA1, positive again. So we suppressed it, we didn't get rid of it. Added Malarone, did additional food sensitivity testing for IgG and IgE foods, found a bunch, which we eliminated, rotated the others, and again, he did really well. He came basically back up to normal for about 6 to 9 months. Here's his food IgG test, bunch of foods. Here's his IgE test, also a number of different, pretty significant reactions going on. So this poor kid, January 2013, another viral illness, major flare of symptoms, actually even more severe. Severe OCD, anxiety, anorexia, food restriction to the point where he lost 40 pounds, which is about 25% of his body weight. So this is really scary. This is really very, very significant. And we treated him with antibiotic rotation. We repeated an IVIG treatment. I gave him Valtrex in case it was a viral trigger. And again, he had this slow recovery. He got better. He got to the point where he was able to feed himself again. He was eating normal meals, taking meds and supplements. He's playful. He's engaged. We're feeling better about things. And then he went to a birthday party and ate foods containing soy, tomato, gluten. And if we look back on his testing, there's a bunch of different reactions here to various gluten, tomato here, soy here, tomato here on the IgE, both IgG and IgE. That night, increased abdominal pain, nausea, vomiting. The next day, more depression and anxiety, intrusive thoughts. Am I breathing correctly? Is the food going down the right tube? More food restriction problems, more reluctance to take medicines, really slow recovery after this. So it's this really clear example to me of the interplay of these foods, with elimination improvement, with re-exposure worsening, including neuropsychiatric status. So it's super, super important. So the next thing I want to talk about is the importance of removing triggers and working to find hidden gut infections. Gut infections, I find, are one of the biggest drivers of inflammation. They can be a significant stress on the body, causing a lot of systemic inflammation. And we find a lot of different pathogens. I'm very, very aggressive about testing this, especially when patients first come in. Before I get them onto any antibiotic therapy, I like to run at least 1, if not 2, stool panels with specialty labs. It is expensive, but the gut microbiome is so complex and diverse that the more testing you do, the more things you find. And the beginning of the therapy is really the best time to do that. So find a lot of H. pylori. And this one I want to touch on a little bit because it's important to understand that we don't know everything about the gut microbiome and the either importance or potential harm from some of these pathogens. There's a lot of research, particularly in developing countries, on H. pylori showing that it is protective, that it's kind of this old friend hypothesis, that earlier on in life, exposure to H. pylori can be protective for allergy and atopic disease. So if the patient doesn't have symptoms and they're younger, maybe don't treat it, right? But if the patient is older and they have a lot of symptoms, they have pain, heartburn, Inflammation, if the patient's over about 40 years old and they have one of these complex illnesses, I will treat H. pylori. I also see a lot of cryptosporidium. This is really, really interesting to me because this is, cryptosporidium shouldn't be there unless there's some degree of immune compromise. People should generally clear this on their own. There's lots of reports with cryptosporidium in the HIV literature. So when I see this in my patients that I'm concerned about tick-borne disease, it's almost like a little confirmation or a tip-off that there's some significant degree of immune suppression going on. We see a lot of entamoeba histolytica, other forms of entamoeba, giardia, dientamoeba fragilis, blastocystis hominis. Most of the gastrointestinal doctors you talk to will say that blastocystis is a commensal organism, that it's not going to cause us harm. But if you look at the research literature, there's a lot of very good evidence to say that that's probably not true, that this could be a player causing fatigue, causing joint pain, cognitive impairment, and a lot of systemic inflammation. So again, the goal is to find and remove any triggers which are going to contribute or exacerbate the inflammatory state of the patient. So when I find this, I try to get rid of it. It can be hard to get rid of. If you come up against it and that kind of rings in your head, you're welcome to contact me. There's some protocols which can be really helpful. I mentioned, this is a stool test with giardia. Testing can be imperfect, and some patients, some practitioners, advocate sort of an empiric anti-parasitic protocol for all patients. I don't do that. I tend to prefer a test and treat program, but again, I do try to test pretty aggressively. So, we are basically a very elaborate transport mechanism for bacteria. There's over 100 trillion bacteria in our body, and the colonization occurs at birth, through breastfeeding, all the way through life. Okay? And the bacteria in and on our body are staggering in their complexity, and we're basically just scratching the surface on what this looks like. It's almost as complex as the outer universe that we send telescopes out into. Now we're trying to understand this inner universe. Again, the number of bacteria in us and on us outnumbers our cells by a factor of 10 to 1, and that's called the microbiota. But if you look at the amount of genetic information that represents, it actually outnumbers our genome by a factor of 100 to 1, and that's called the microbiome. This is a nice image from a recent New York Times article that kind of gives you a visual representation of what we're looking at here. And the state of our individual microbiome can have a huge effect on our overall health and resilience. There's a really interesting article in Nature 2012 called The Reciprocal Interactions of the Intestinal Microbiota and the Immune System. And what we can see here is that in a state of eubiosis, or beneficial balance, there's these microbe-associated molecular proteins, or MAMPs, which stimulate the epithelial cells, and they secrete cytokines that promote tolerogenic macrophages and dendritic cells. We see increased T regulatory cells. We see increased IgA production, which is an important marker of the health of the gut immune system, and dampening of the inflammatory effector response. This is a very good thing. Conversely, in a state of dysbiosis, where there's mucosal injury, there's some kind of a pathogen invasion, you see increased secretion of pro-inflammatory cytokines by the epithelial cells, and these dendritic cells and macrophages then promote more of a Th1 and Th17 inflammatory response, right? And this is not a good thing. And there's this communication that occurs, this bidirectional communication between the gut, the microbiota in the gut, and our brain. And the research literature on this is just super, super fascinating. There's lots of studies there for you to review if you're interested. So the bacteria can signal to the brain using bacterial products in the bloodstream right to the area postremia. There's cytokine release from the gut immune cells. There's gut hormones which are released like 5-HT, and they can also communicate directly via afferent neural pathways along the vagus nerve. So bacteria talk to the brain. But the opposite is also true. The brain talk to the bacteria. So stress, emotions can directly influence the microbial composition of the gut through the release of stress hormones and sympathetic neurotransmitters. And this can directly influence the gut physiology and also change the composition of the microbiota. So it's a two-way street. So we can measure gut function with a variety of different labs. We can look at markers of digestion, markers of absorption. We can look at bacterial balance. We can look at levels of butyrate and other short-chain fatty acids, which are food for the beneficial or commensal organisms. We can look at inflammation, lactoferrin, calprotectin. These are tests you can also order from Quest and LabCorp. You can write for a fecal lactoferrin for gut inflammation and track that. And we can get some gauge on the levels of the beneficial or potentially pathogenic bacteria. This is helpful. It's still very imperfect, given that the vast majority of the bacteria that live in our guts are anaerobic, and so the ability of us to culture them or grow them is fairly limited at this point. They also give sensitivities on pathogens, which can be helpful. So if they do isolate a pathogen, they can tell you what it's sensitive to. This is another example of a GI function panel. One nice thing about this one is a little bit cut off down here, but you can also measure IgA level in the gut. So that can be really helpful. So Dr. Horowitz touched on some information about probiotics. These are absolutely critical, in my opinion, to be used both along with and after use of antibiotics. The scientific literature has a lot of support for the use of probiotics, a variety of different mechanisms. They can inhibit NF-kappa B, translocation to the nucleus, upregulation of intestinal barrier function, IgA production, NK and phagocytic cell activity can be improved. They can help to induce dendritic cells and FOXP3 positive T cells with anti-inflammatory effects. And those FOXP3 positive T cells are kind of a holy grail right now. Everyone's trying to figure out how to get to those, because those are really, really important, again, for the Treg cell function and anti-inflammatory pathways. Again, decreasing inflammatory cytokines, arresting the growth and outcompeting pathogens. And there's a good evidence in the ulcerative colitis literature for both preventing relapse and helping to maintain remission. Saccharomyces boulardii, very beneficial probiotic yeast. This is a very important placeholder. It's not killed by the antibiotics, and so this is one that you can actually give patients at the same time as they're taking their antibiotics. That's always a little bit of a problem, is people having to try to take the probiotics at a different time of day as the antibiotics. This one does not have that restriction. There's evidence showing it can help to decrease bacterial overgrowth, yeast overgrowth, help to prevent and treat C. diff, antibiotic-associated diarrhea, decreases gut inflammation, bacterial translocation, and prevent and treat C. diff infections. There's a bunch of references there. My baseline dose for people is to do 1 pill twice a day, and if they're having 1 pill twice a day, and if they're having any diarrhea or gastrointestinal irritation, you can go up as high as 3 pills 3 times a day. There's not a lot of negative side effects. Sometimes flooding their system with it can really, really help to modulate gut disruption, which when they're on a bunch of antibiotics, you will frequently run into. So the numbers that Dr. Horowitz mentioned this morning in terms of this is the Saccharomyces, but in terms of the general probiotics, sometimes we'll be using 200, 400, 800 billion organisms twice a day. So that can be hard to achieve with commercial over-the-counter products. Some of the better supplement manufacturers do have really high potency formulas. There's a formula called VSL number 3 available through the pharmacy, which has there's a packet. They have pill and packet, but each little packet has 400 billion per packet. So you'll be impressed if you have people who are on these intense antibiotic protocols and they're not able to tolerate them. If you really ramp up the probiotics, you can really help them to tolerate the treatment. This is a nice article, 2013, Trends in Immunology. just showing some of the effects of different lactobacillus species. So Lactobacillus plantarum up here can bind to toll-like receptors, modulate NF-kappa B, decrease IL-8. Over here, Lactobacillus rhamnosus can help to tighten up tight junctions and also decrease levels of IL-8. Down here, Lactobacillus acidophilus, binding to the dendritic cell receptors, can, again, the FOXP3 positive T cells, Treg cell pathway to decrease Th17. So what we all are trying to figure out is how to, what we all want is this flourishing gut ecosystem. And again, some of the therapies that we are required to use in a lot of times with tick-borne infection patients can really devastate the gut. And if left alone, you can have an overgrowth of species that are either pathological or can adversely affect us. So really, again, probiotics, prebiotics, can really help to restore the ecosystem. And there's this big discussion going on in the literature about bacteriotherapy or fecal transplant. And at this point in the US, it's approved only for patients with recurrent C. diff infection. But the literature has some very interesting information out there about the potential for fecal transplant to benefit a lot of different illnesses, including inflammatory bowel. So I'm also, I was an integrative medicine doctor before I became a Lyme doctor. So it didn't come naturally to me to use a lot of antibiotics on patients, and because of my respect for the gut, it always comes with some degree of concern. I do wonder now, if maybe it might be one possibility is that once patients are in remission and have stabilized and can get off of the antibiotic therapy, if at that point it might be a good idea to think about doing a fecal transplant, trying to reboot their microbiome. Again, it's hard to access that in this country. There's a bunch of people doing, sort of homebrew fecal transplants. I don't really recommend that. There's a lot of issues around screening, finding the right donor, as well as the problems around the fact that most of the microbiome, most of our gut bacteria are anaerobic, so you're not going to get those guys. You're going to basically kill those in the process. But there are some groups. There's a group in England called the Taymount Clinic, who are really pushing the boundary in terms of what they're doing to preserve those bacteria samples. So they're doing the whole process from collection to insertion of the sample under anaerobic conditions. And so all their processing facility, et cetera, are set up to optimize that. So there's really also an explosion in the literature discussing the importance of the gut. And this is a nice article from 2013 talking about some nutritional mechanisms to protect against gut inflammation. And it's a nice summary of some of the different interventions that we're talking about, including probiotics up here, got a little cut off, but prebiotics up here. It's an interesting idea of this kind of microbial fingerprint that can be either anti-inflammatory or pro-inflammatory. I noticed in the book that you guys got that it's pretty hard to read some of the details on this slide, so if you guys are interested, if you want to look at these in a bigger form, feel free to contact me on my website, and I'll send you a PDF that you can look at in larger print. So I love looking at slides like this. It just gets me really excited. And because it's just so nice to see the scientific literature kind of catching up with, being able to explain the mechanisms behind some of the interventions that we've been using and find work. But it's just great. I love the science and I love the mechanism. It's just nice to see these beautiful pictures of it. So again, Hippocrates said, "Let food be thy medicine," and diet is really, really critical here. Diet can be really hard work. It's not easy. The only thing is that the benefit would be that our patients are very motivated to do whatever it takes to get better. So I would really encourage you to look closely at this, and if and when you decide it's something that makes sense, just tell the patients to do it, because they'll do it. If you say this is important, they will do it. And it just takes sort of having that conviction in your own head that this is a helpful thing. Diet can be helpful for strengthening the immune system, supporting the immune system, helping to reprogram the immune system, decreasing that local systemic inflammation that we've talked a lot about, and downshifting autoimmunity. And there's a lot of different choices out there. There's probably thousands of different books, different theories. This is what you should do, this is what you shouldn't do, but it's really very individualized, okay? And the thing that's also interesting is a lot of similarities in all of these diets. There's contrast for sure, but what I hope to do is to kind of explain some of those back and forth so that you guys can have a little bit of a working knowledge of those. I think the first thing that everyone really needs to pay attention to is gluten. This is really a key player. And it's a problem for many of us, if not most of us, I would argue. Gluten is an extremely highly immunogenic molecule. And over the past 50 to 70 years, it's become much more complex genetically. The gluten has been bred to be, over the last, scientifically engineered to become, so that your bread is softer, so it's more, palatable. So just in the pretty recent, last 3 or 4 or 5 decades, the actual molecule has changed a lot and gotten much more complex and difficult to digest. And there's a lot of people, and it's almost surprising to me, how many people benefit from the elimination of gluten in their diet with really surprising and far-reaching benefits. So I really think this is an important starting place for people who can only focus on one major food elimination. There's more and more gluten-free alternatives. It's gotten much easier than it was in the past. And again, really broad-reaching benefits in terms of inflammation, immune activation, autoimmune triggering, both the results from eating it and also the benefits from eliminating it. It's really, really important to understand, however, that this needs to be binary, okay? If people are going to be gluten-free, they need to be 100% gluten-free. And I'm not saying that everybody needs to be 100% gluten-free for the rest of their lives, but if you have a patient who's saying, well, I'm trying to be gluten-free and I have gluten maybe a couple times a week or maybe even just once a week, it's very possible that's not going to be enough for them to see the benefits, okay? You really need to encourage people to do a 100% gluten-free diet for probably a minimum of 2 to 3 months to see if it's going to work. This is what the gluten molecule looks like. There's thousands of different studies that document the harmful effects of different components of this gliadin complex. Down here in red, this area is cytotoxic. Up here, this is immunomodulatory. These blue areas promote the release of zonulin and gut permeability. This green area over here increases IL-8 release. There's a number of different resources out now that are really helpful for this. Actually, Alessio Fasano just came out with a new book called Gluten Freedom. There's also a book called a book called Wheat Belly by William Davis, who's a cardiologist. And another one called Grain Brain by Perlmutter, who's an integrative neurologist. There's a lot of resources out there for people. In terms of testing, I recommend that you really aggressively test this. Look for IgA and IgG antibodies to tissue transglutaminase, anti-endomysial, deamidated gliadin. This is much more sensitive and specific than the older test, which is just looking at the gliadin antibodies. You should also test an IgA level. This is very important. They don't always include it on the test panel. And you need to see basically, if these come back negative, is the person making enough IgA for those to be positive, or is it a false negative? You should also look at the genetics, the HLA-DQ2 and DQ8. These are available at all the mainstream labs to understand, is this possibly true celiac, or is this more of a gluten sensitivity picture. There's labs available, again, we touched on this, expanded antibody profiles. I use these all the time in my practice. I find them to be very, very helpful. They pick up many more cases than the regular labs through the traditional mainstream labs. However, this is out of pocket, so frequently if people can't afford it or they have insurance that will cover the other testing, I'll do those first, and then only if negative, try to get these done. A lab called Entero Lab also has stool antibodies. So there's a whole other beast called gluten sensitivity, which many patients can have inflammation and reactions to gluten without having clear antibodies on testing. They can be negative, HLA DQ2, DQ8, but still have a reaction. This is a very active area of research, particularly for folks like Alessio Fasano. So, even if you do the testing and there's nothing there, I would argue that it still makes sense to have people try the diet for a period of time. And again, I think you'll be really impressed at the amount of things that go away and get better. And what's always amazing to me is that, yes, it's hard, but it's doable. And if there are a number of things that get better, that's not something I'm going to be able to treat with any medication or supplement or other intervention. That needs to be dealt with through diet. And in our patients with the level of complexity of illness, anything that you can get rid of off of their plate is of huge benefit. If you do the diet, and again, they do that 100% adherence for 2 or 3 months, and you still haven't seen any real benefit, what I would recommend doing is an aggressive re-challenge where they have gluten 3 times a day for 4 or 5 days and see what happens. If they do this 2 or 3 months, totally gluten-free, didn't notice any benefit, and they do this, they have gluten 3 times a day for 4 or 5 days, and they have no adverse reactions, they're probably fine having gluten, right? That's kind of a good protocol for figuring out who's who. So anti-inflammatory diet is also a really good starting place for a lot of people. And what we know is that what we eat can increase and decrease inflammation through many different mechanisms. There's the arachidonic acid cascade, fatty acid balance, glycemic load and blood sugar balance. This is extremely important. Carbs, sugar, you eat those in isolation without protein and fat or fiber, you get a blood sugar spike, insulin spike, and insulin is one of the most inflammatory molecules in the human body. Okay. So, the other thing that's really important with the anti-inflammatory diet is you end up having a lot of increased vitamins, nutrient-dense foods, increased antioxidants, again, as you work here to eliminate the allergies and sensitivities, et cetera. Some of the more pro-inflammatory foods include, possibly most grains. Red meats can be more pro-inflammatory. However, there's definitely evidence to say that if it's grass-fed, free-range, and hormone or antibiotic-free, that it's less inflammatory and has higher levels of beneficial fatty acids. Other foods like citrus, soy, legumes, although there's variation in opinion on that, nightshades, dairy, processed foods, and like I mentioned, sugar and high glycemic index. These are all some of the more pro-inflammatory foods. The processed foods are really a major, major issue. If you think about what we have eaten for our evolutionary history, the last 10 to 30 years has seen a dramatic change in that. And you add on top of that, the toxins in our environment, you add on top of that some of the tick-borne infections and gut disruption, and what you have is people with really disrupted guts being exposed to chemicals, coloring agents, preservatives. These are just coming right across into the bloodstream through that leaky intestinal barrier and triggering our immune system. So really not to be underestimated. This is another nice handout on the anti-inflammatory diet, again from the University of Wisconsin. And again, going to PubMed looking for articles, it's really nice to see that you go to PubMed, you type in anti-inflammatory diet, and you get over 10,000 citations. And I like this little graph over here, results by year. There's this marked uptick in the amount of people that are studying this. So it's nice to watch. Kenneth Singleton, Lyme literate doctor, has this book called The Lyme Disease Solution, and then one of his patients, I believe, and her family member published his cookbook based on that, so a nice anti-inflammatory diet. His book is great for walking patients through it. Dr. Horowitz's new book also has some nice information on diet, as does Dr. Burrascano's guidelines. This is a book by Nicola McFadden on the Lyme diet, as she calls it, which is really a good option for patients. It's pretty easy to read. It's a small book, anti-inflammatory, immune supportive, detoxifying, helps to balance blood sugar, and helps to promote alkaline balance in the body. So the paleo diet, why paleo? Basically, the idea is to eliminate foods that have been introduced relatively recently on the evolutionary timescale. So the focus is on eating, fruits, vegetables, nuts, seeds, berries, and proteins. Okay, and the literature really does support benefits in decreasing inflammation, decreasing immune triggering, and autoimmunity. We're going to talk about the GAPS diet as well as the SCD diet, specific carbohydrate diet, a little bit. The paleo diet is not quite as strict as those. And probably if you have a patient who has very, very severe gut imbalances, it might make sense to start with either the GAPS or the SCD diet and then move into the paleo diet when they're more ready for kind of a maintenance phase. So again, whole foods, nutrient density, avoiding processed foods, few or no grains and legumes. We're just simply not optimized for the digestion and absorption of these products, particularly if we have a lot of gut disruption. It does permit starchy plants like sweet potatoes, plantain, taro. As a contrast, GAPS does not. This tends to be lower carb intake, although this is modifiable. Some people out there talking about, again, there's no one diet for everybody, and so the idea is to find, use some parameters, but find what works best for you. Some people need more carbs, particularly people with low adrenal or low thyroid issues. You need those carbs to make those hormones. Low glycemic index, high fiber. This is a really nice resource that's out. The author's name is Diane Sanfilippo. The book is called Practical Paleo. Has a lot of really nice handouts in it. And these handouts are also available on her website as PDFs, so really easy to get to, easy to give to patients. She also does a nice job color coding and kind of cross-referencing different trigger foods. She has the nightshades bolded. She has star by some of the FODMAP foods. I'll talk about what that means. There's a big, and it's interesting because there's a big focus in paleo on healthy fats. And there's it's interesting that some of the saturated fats are coming back in style. Coconut oil, avocado, even things like bacon fat from a healthy animal. And so she created this T-shirt that says, "Gluten is bad, bacon is rad." So this is a doctor in France, Dr. Seignelay, who looked at autoimmunity in his patients and diet. He kind of a modified paleo-type diet. And he defines success in these patients as being about a 50% reduction in symptoms. A bunch of different types of autoimmune illnesses, varying sample sizes. This is not a randomized controlled trial, but pretty impressive numbers in terms of how many patients he was able to reduce their symptoms by 50%, from anywhere from 80 to 100% of those patients. Here's a list of some paleo resources. Lots of really smart people out there, researching and talking about this. So I definitely suggest you take a look. So I talked a little bit about the GAPS diet before. This is one of the most effective healing diets, but also very, very difficult to adhere to. Basically, totally eliminates grains, and focuses on specific disaccharides and polysaccharides that are difficult to digest and can promote dysbiosis, leaky gut, yeast overgrowth, et cetera. One of the most important take-home points on the GAPS diet, and I recommend that everybody looks at, is this idea of using broths for healing. So bone broths have a really high amount of collagen and glycosaminoglycans, which are really magical for healing the gut, for healing connective tissue, and also the brain. So in our patients, this can be really, really critical. So the GAPS diet was based in large part on the specific carbohydrate diet, but the main difference is that, again, the bone broths, a lot of emphasis on fermented foods, less beans, allows some dairy, but it's more of a gradual introduction. So I want to segue for a minute and talk a little bit about small intestinal bacterial overgrowth, because a lot of these symptoms can be exacerbated by tick-borne infections with the autonomic nervous system inflammation and dysfunction that can slow down peristalsis or even paralyze the small bowel motility. So you get a lot of symptoms: bloating, gas, pain, constipation, diarrhea, or a mix of the two, malabsorption, and a bunch of systemic symptoms as well. And what happens here is that the bacteria in the small intestine can overgrow and ferment food that was meant for the host, producing hydrogen and methane gas, which we can test. We can do a breath test for this. There's a variety of treatments that are really helpful for this, including diet, antibiotics, both prescription and herbal, prokinetics. It's a very excellent article that was published in the Townsend Letter in February of 2013, if you want to read more about that. So I'm getting a little tight on time, so I'm going to move through the body ecology diet kind of quickly. Basically, very helpful for controlling yeast overgrowth, which is very, very important in our patients as a baseline. A lot of them come in with yeast issues, but then that can get further exacerbated by the antibiotic protocols. So if yeast is an issue, I definitely recommend taking a look at the body ecology diet. So we're going to close with just one more case. Another patient of mine is a 54-year-old female that came in with a bunch of different symptoms. If you read down that list, it pretty much sounds like all the patients we've discussed today and many of the patients that we see in our practices when we're taking care of tick-borne disease patients. I did some testing on her. There was a number of different positive markers for tick-borne disease. She also had low adrenal hormones. She had an elevated, 2 different markers of inflammation, the SED rate and the CRP. And over the course of working together, we did a bunch of different treatments. We tried a bunch of different antibiotics. We rotated them. We tried a bunch of herbs. We rotated them. She got a little better with each regimen. She was slowly improving, but it was incomplete. So we talked about diet again, and I convinced her finally to adhere to a gluten-free diet. And within days, her bloating and gas was about 75% better. Over time, she was able to tolerate dairy again. This is not uncommon. People who are lactose intolerant should very, very strongly look at gluten because you get damage to that brush border and you lose the ability to produce lactase. So, not tolerating dairy can frequently be a tip-off to gluten issues. She began to tolerate dairy again, like I said, as her villi recovered. And she said, I'll never go back to gluten. So then she started to kind of up the ante a little bit. She read the Singleton book. She worked on his diet. And she said that was a great way for her to begin sorting out what she was reacting to. She lost some weight. It was kind of the next step for her to get clean and gluten-free while eliminating all of the white starchy flours. We call this the white menace. Bloating was better, stomach pain was better, and an overall sense of feeling better. At one point, she kind of fell off the wagon. She gave into some sugar and carb cravings. She immediately put on a lot of weight. Her inflammation got way worse in her joints. She had aches and pains in her finger joints, feet, hips, shoulders, depression, this feeling of hopelessness, brain fog. This can get really confusing because this is what a lot of our patients have from their infections. But it can also be caused by diet, and dietary intervention can improve these. So really, you just need to work all the different angles. At one point after that, I got her to start a paleo diet, which really helped her with her sugar cravings. And she said it was very, very clear that sugar is my enemy because when I stop eating sugar, I feel much less inflamed and much more clear-headed. Inflammation was all better. I feel more helpful, less depressed. My brain fog is lifting. I still have bouts, though, and my fatigue is much better, overall sense of improvement. So she had some kind of words from the wise for us. She said that if people are going to be successful at diet, lifestyle change, it's really important to have good resources, to have encouragement, because if you're not prepared and you don't have all this good food around you, you're going to fall back into your old habits. It's easy, And, you really need support systems. You really need time. And you need resources to find that healthy food. So these are all, things that we need to kind of set people up for success and find ways to resource them. There's a nice list here of some supplements that are helpful for gut healing. We're going to breeze right past it in the interest of time. But look each one of these up. There's data to support all of them. This is a cool picture. This is administration of GLA, which is a beneficial fatty acid. And this is staining for occludin here both before and after the administration of the GLA. So tight junctions are improved. So in conclusion, the gut plays a central role in Lyme and tick-borne infections. And it's both a source of and a solution for inflammation. It's dynamic, it can be damaged, and it can also be healed. And interventions that heal the gut will have far-reaching benefits for all patients. What we want to try to do is to find and treat the tick-borne infections. We want to find and treat gut infections. We want to eliminate food allergies, food sensitivities, work to heal the leaky gut, recommend the appropriate anti-inflammatory and anti-autoimmune diets, and use key supplements. I think it's probably grain-free for most, nutrient-dense, unprocessed foods. As Michael Pollan said, eat food, real food, mostly plants. Lots of fermented foods, probiotics, broths, small frequent meals, trying to achieve glycemic balance. Avoid alcohol and caffeine, hydrate, and I believe that you and your patients are going to be amazed.